There you go. We got a few claps. Got some wonderful people in the studio. Thank you for watching, and thank you guys for joining us in the studio also. I'm your host, Doc Bob Lee, and you're watching Open. It's that live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Leading things off, our first guest is a Dementia Care Specialist. He joins us to highlight the services that his organization offers to families and individuals directly impacted by Alzheimer's. Please welcome to the show, Dante Tipiani. Dante, welcome to the show.
Good morning, Dr. Bob. How are you?
Good. You know, you're no stranger to the show. How have you been?
I'm great. Thank you. Thank you for having me back.
Yeah, well, you know, you're always welcome to come back and share some nuggets with us. You know, our community deserves to hear from great people like you. For those who didn't meet you before, just give us a little overview how you got started and what you're doing right now.
Yeah, so let me just start off by telling you a little bit more about what CaringKind is.
Okay.
And CaringKind is one of the leading experts on Alzheimer's and dementia caregiving. And the reason I say experts is because we've been around for over 40
Yeah.
years. So we have 40 years of experience working directly with our community partners to develop three things, Bob: information, the tools, and training that people need, families need for support of those affected by dementia.
Yeah. So, what led you into this direction, into this journey?
So I have been a geriatric social worker for over 40 years. I'm sorry, not 40, 20 years in healthcare.
Yeah.
And I started out as a geriatric intern, and I specifically worked with older people in hospice care, and that led me to different areas of palliative care and caregiving. Over the last almost 4 years, I've been at Caring Kind working directly with family members, providing coaching, providing education and information, and most importantly, a guidance, because caregiving is a journey, and we provide a
Yeah.
guidance, a guide of how to walk this journey.
Yeah. Now, there's a difference between palliative care and the other thing that you,
Hospice care.
hospice care. Give us that
Yes.
difference.
So hospice care is an entitlement that
Yeah.
insurances pay to provide a program when two physicians specifically diagnose someone who has a terminal illness and has a prognosis of 6 months or less to live. Okay, so that's the criteria: 6 months or less to live, um, by two physicians, versus palliative care, which is ideally it can start when someone is diagnosed with a serious life-threatening condition.
Yeah. Well, both can be done from home in a
Yes, yes, they
or in a
can both
hospital
be done.
situation.
They can both be done from home, from the hospital, and from nursing homes. Nowadays, the majority of the services are home based.
Yeah.
So oftentimes people think about hospice as a place where you go to die, but hospice is can also be provided at home as home hospice.
But Caring Kind usually deals mostly with Alzheimer's and dementia patients, right?
Yes,
Yeah.
yes. So what we do, we have a helpline that is staffed by dementia specialists to provide individual and family consultations. And we have a vast network of support groups, education programs, and early stage programs, and a wanderers safety program. So
Mhm.
what we try to do is to provide that service for everyone. Ideally, in a perfect world, everyone who seeks this type of help should receive it when they need it.
Mhm. Now, how can you tell when somebody needs that type of care? Who calls? A family member? Because I don't think the patient will call, right? Somebody
We've
will.
had patients who called. We've had patients who walk into our office. We have neighbors. We have the police department. We have professionals. We have family members that hear
Yeah.
this type of outreach, and um, they call us up. So a vast network of different people that call in.
People get lost and forget how to get home, or
Yes, yes. So that's part of our Wander safety program, where the police, we work with the police department to track people in case they do get lost, and they have a bracelet. And if someone does get lost, then we are able to communicate with the family members to locate them.
and it's called the Wandering Safety Program.
Wander's Medic Alert Wander's safety program.
Yeah, yeah.
Yep.
So, how can you tell if you are a recipient or a person who would like to receive care for Alzheimer's or dementia?
So if ideally someone who is diagnosed with a dementia should seek certain type of services, whether it's just basic information or support, education about what is going to happen, talk about a plan, and think about the future.
Yeah, and before
Uh,
before you even get there, before you get to the place where you get screened and get diagnosed with it, how can you tell that this is happening to you? It could be a family member that says, "Hey, you can't remember the way you used to, or you're slipping,
mm,
you're forgetting where we're going, or how to get back home, or how does it work? I mean,
yeah.
what are
So
some of those
so there
symptoms?
there 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 are 10 classic symptoms
10
of
classic symptoms.
short-term memory, uh, where it affects a person's ability to live independently. So there are different signs that are out there that give, like, doctors or other people a red flag of why this person should have an evaluation, a memory evaluation, or go to a diagnostic center to rule out other things that may be affecting memory.
Yeah,
So if someone is concerned about their memory, the first thing that should happen is talk to your doctor, and have an evaluation done.
yeah. Because people forget, and that's probably normal, but, sometimes you wonder, you say, hey, wait a minute, I knew
Right.
that.
So, some of the classic examples that I often talk about when I go out to senior centers
Yeah.
to talk about what is dementia is, pretend you're going into your house and you forget your keys. You go back, or you try to remember, okay, where are my keys,
Yeah.
versus leaving the door open, or not thinking about your keys at all, or going home, and rather than putting your keys where you always put them, you put them in the fridge, or you
Ah,
put your purse in the fridge. So those are different things, flags that
yeah.
impact judgment, impact your ability to live independently.
Yeah, I mean, you could be very, very busy one day, and sometimes you don't know how your purse
Right, you
ended
could
up in the
forget, and
freezer.
that's normal. You could forget, but if you put your keys in the
Yeah.
freezer, or your wallet in the freezer, that's something different. That's something to check out.
Yeah, yeah, yeah. So we love all the work that you're doing in the community. What are some of the other things that you're doing with the caregiving, the Caring Kind organization?
So we have different programs for family members,
Hmm.
including like the one-to-one or family. We also have a caregivers champion program, where everybody ideally who is taking care of someone with dementia should be honored. Uh, and this program honors those people because, and why do we honor them? Because we
Uh-huh.
recognize the resilience, the compassion, and sacrifice that caregivers do. And it is our belief to acknowledge this. So
Hmm.
our group, which is about 75 uh, care partners right now and growing, uh, is really meant to raise concern and awareness, uh, to advance our cause.
Yeah. And you have people that come back that help out, right? You have a story about a family or individual that was greatly impacted by the work that Caring Kind is doing in our community?
Yeah, so I have tons of stories. I actually provide services in English and in Spanish, and there one story that comes to mind is of a wife caring for her husband, and he is in the last stage of dementia,
Yeah.
where someone is really bedbound and unable to do a lot to self care, uh, and she is isolated, feels alone even though she lives with her daughter, and is taking care of her husband, and concerned about the welfare of her daughter and grandchildren. And so we connected because her doctor referred her to us. And what we provided is that type of support and network, kind of building the bridge from the community,
Yeah.
from the healthcare system to what's out there.
Yeah.
And at the end of the day, she received support. She received information and a guidance of how to access certain services in the community.
So I want you to say it in English and in Spanish. You know, you can keep it short. If you need our help at Care and Kind, please visit us where, or they can go where, in English and in
Yeah.
Spanish.
So if you feel you need our services, our programs, or just want to know more about dementia, you can do that two ways. You can either go to our website, which is www.caringkindnyc.org, or call our helpline at 646-744-2921. Y si le gustaría recibir más información sobre los programas y los servicios que tenemos en Caring Kind, puedes obtenerlos en dos maneras. La primera es ir a la página de web, que es caringkindnyc.org, o nos puede llamar al 646-744-2900. Gracias.
Hey, thank you so much. Thank you for sharing, okay?
And thank you so much for having me again, and I can't wait to see you again.
Can't wait to see you too. Care and Kind Specialist. There he is, Dante Tipiani. Thank you for all that you do
Thank you.
and continue to do in our community. We appreciate you, man. Well, we'll take a quick break. I've got more open. It's all coming your way next.